Hello and welcome to Baby Health. I'm Dr Sandip Gupta. I'm founder of website child healthcare website babyhelpdr. So I'm a senior pediatrician and childcare expert currently practicing in Bangalore. Today I've come with an important topic which is not known to many and many people don't understand this. So I'm going to tell you about what are the benefits of breastfeeding for mothers. For mothers' health, what are the actual benefits of the breastfeeding? So I have taken a lot of videos and a lot of discussions about breastfeeding, how it helps the baby, how it protects the baby from infection, how it takes care of nutrition, and how in the long term it is beneficial in avoiding asthma, diabetes, obesity in children in the long run. Even allergy is prevented by breastfeeding. But today I am going to talk about a totally different issue, which is related to maternal health. So how maternal health is actually affected. So what benefits mother will get by doing a breastfeeding is the topic of today. So first of all, I'll start by telling that once the mother starts doing breastfeeding, she is emotionally comforted. So she feels very happy. She likes it, and it is a stress reliever. So what happens is the hormones which are released by doing breastfeeding, like prolactin and oxytocin, these actually reduces the stress in mother and it makes the mother feel happy. As well as it has been scientifically proven that so many mothers who do breastfeeding, they have lesser incidence of postpartum depression. So postpartum depression is a very common condition which happens in quite a number of mothers in the immediate postpartum period, like after the delivery. So it reduces the incidence. So if you do breastfeeding, the chances of you getting postpartum depression is less. So this is one of the major benefits of doing breastfeeding, that it takes care of the emotional health of the mother. Okay. Second is it actually helps in post-pregnancy weight loss. So what happens is during the pregnancy, mother gains around 11 to 12 kg of weight, so which becomes a problem for them later on to set that weight. So what happens when the mother's body is making milk for the baby, it uses the calories which have been stored during the pregnancy. So whatever weight is gained during the pregnancy, if you do exclusive breastfeeding as a mother, you will be finding it much easier to actually lose that weight. So that is a very important aspect. Another important thing is, for mothers, what happens is, immediately you would have heard and listened many people complaining about bleeding during the postpartum period. So after the delivery of the baby, there's a lot of bleeding over in the vaginal area. So this bleeding is actually reduced by breastfeeding. How it happens is, so once the mother does breastfeeding, like I said before, there is release of oxytocin. Oxytocin is a hormone which helps in uterus to contract. So this hormone actually prevents the blood loss. So this is a very important benefit of breastfeeding. Also, this oxytocin helps in contraction of the uterus to pre-pregnancy size. So uterus actually swells up. Uterus is the organ in which the baby actually resides during the pregnancy time. So after actually delivery, the uterus is quite big compared to the pre-pregnancy size. So it is almost 20 times bigger than the pre-pregnancy size. So what happens is, this oxytocin helps in the contraction of uterus to its pre-pregnancy size. And mothers who do breastfeeding, this reaching of the pre-pregnancy uterus is a very fast thing. So it helps in that also. So that is a very important aspect of breastfeeding. Then in the long run, it has been seen that if you do exclusive breastfeeding as a mother, there is definitely very strong evidence to suggest that breast cancer and ovarian cancer risk is less. So mothers who do proper breastfeeding, they have a lower incidence of breast and ovarian cancer, which is a major benefit of doing breastfeeding. So another benefit of breastfeeding is it helps in spacing between the two babies. So what happens is, the hormones which are released, like I said, prolactin, it stops the ovulation. So making up the ovum, it stops. So then there is lesser chances of you conceiving again in a very short period after delivery if you do breastfeeding. So breastfeeding promotes prolactin synthesis, which actually inhibits ovum production. So there is lesser risk of getting another pregnancy. So there is natural contraception if you do breastfeeding, so which we call lactational amenorrhea. So this is very important. For actually, we need to have at least a space of 1 to 2 years between the two babies. So this is nature's own way of preventing another pregnancy immediately after one pregnancy. So that is another major benefit. Another benefit of breastfeeding which we seldom know is breastfeeding can prevent type 2 diabetes. So what happens is, actually breastfeeding promotes like insulin activity, insulin sensitivity, it increases. So diabetes is a disease, type 2 diabetes is a disease of insulin resistance. So breastfeeding decreases the insulin resistance and prevents the type 2 diabetes. So that is one important aspect. And many of the researchers have shown that breastfeeding actually increases the bone density. So in mother's case, it increases the bone health also. It makes the mother's bone more stronger. It helps in the calcium deposition in mother's bone. So this is again major advantage of breastfeeding. And last and not the least is it saves a lot of cost. See, breastfeeding is free, it is cost effective. Whereas if you do bottle feeding, there will be coming at a cost of milk plus the accessories you use. So these are the major benefits. Among the benefits, you should always remember it prevents postpartum depression, it makes good mental health for baby, helps in mother and baby's bonding, it prevents cancer in mother, breast and ovarian cancer in mother's health, and it helps in losing the pregnancy weight as well as the uterus size reduction, and it stops the postpartum bleeding. So these are the major health benefits. So I would always encourage you to do breastfeeding, and sometimes in breastfeeding you may encounter some problems or some doubts, so for which you can reach out to me on Facebook, on YouTube. You can comment on this video section if you have any doubts, I'll clarify that. But you should have a strong resilience to do breastfeeding, because it has got multiple advantages for your health also. Not only the baby's health, it takes care of your health also. Thank you for listening to us.